Welcome to Perspectives with Pinnacle, exploring the evolving world of healthcare. Let's navigate complexities and unlock new perspectives together.
In this episode of Perspectives with Pinnacle, partner Christopher Fete sits down with Alex Krouse, board member of the American Association of Provider Compensation Professionals, to discuss the story behind the organization and the value it brings to the healthcare industry.
Yeah, so the story of the AAPCP, it was, and I'll try to keep it brief, but really, part of it is my story of when I started at Parkview. So when I came to Parkview in 2016, our VP of Finance, who designed all the comp models, left. And I was kind of the person who dealt with outside valuators and all of that, dealt with the contracts. And so as nobody else knew what a work RVU was. So they said, hey, Alex, can, you take this over? And I said, okay. I don't know if they asked, but I took it over and I figured out that there wasn't really anybody within the organization that knew what I was talking about. Very few people. It's a small group. And obviously you had external partners where, they, of course, you could work with them, but there really wasn't just, colleagues to bounce ideas off of. And I was very used to that as a lawyer, just working with AHLA and so on. So I started reaching out to folks, found a small network. Over time, that network started to grow. And a group of us kind of, through different discussions, it wasn't just one discussion, we kind of figured out everybody was in different professional associations, even though we all did the exact same thing. Yeah. And so that's where I kind of got, the idea, along with others, of maybe we should have a community here, but maybe it's not profession-based in the sense of you're a CPA, you're a lawyer, you're a operations leader, but it's a body of work that you work within. So that was 2020, and here we are.
Yeah, that makes a lot of sense. I mean, I think about, to your point, going to the different conferences, a lot of people do it only to go for the credentials. So whether you're a lawyer, a CPA, or healthcare finance, HFMA, like things like that, but getting the credential to more focus on a body of work versus like a profession is a different ballgame. So I think, and we see that, right? Like, where do you find value in having your team as an independent firm start participating in these organizations, right? So we live it and breathe it. For so many years before this, we were those educators for the clients, right? And this gives a community not only for our clients, but a community for our young professionals and our senior professionals to have that collaboration, and even gets rid of some of the competition in the space, right? Like in terms of that feeling of competition. And we're in this together. We're creating this content and this experience for the betterment of the ecosystem, which is awesome.
Absolutely. I think as it relates to just the vision and how we progressed as an organization, I do think, you mentioned about having the community where there's not this competition, but we are all in it together. I think that's very much so our kind of viewpoint, like whether it's individual members that I talk to that become members, and those are individuals that maybe they work in a hospital, maybe they work in a consulting or valuation firm, but I think all of them recognize like, hey, this is a great opportunity for me to actually chat with other people. And they may be in a competing firm or a competing health system, because I'm dealing with somebody down the street, that I'm just talking to but it's a great conversation where you can actually sit there and say, you know what? Yeah, we're dealing with similar issues, and having an avenue where, you with your panel and others talking about what's going on in the industry just didn't really exist in this form before this.
Yeah. And I think with that, along that, right, some of those other ones, and the other forums are great forums, but for companies like us and companies like our competitors, you go to those other ones and you're just the show on the outside of the content. Whereas here, we're able to drive some of that innovation in those conversations and education collaboratively with the peers in-house, right? So it's a great platform for that. And just watching the growth over the 3 years is incredible. Like I was one of the ones that stood up for the first one, you know.
You were
It was like I was an MNOG.
yes.
But it's amazing to see the growth. I mean, and I know our firm, I know others too, because it has created that cross collaboration with other firms.
Yeah.
When we all found this, we're like, this is the right space for others, right? So, you know, we talk about it with our clients when we go places. Have you ever been here? Have you ever done this? Like, you should look into this. Or do you want to speak on this with one of us? Like, it's tremendous growth. Like you probably know the percentages off the top of your head, but from year one, because I remember like doing some of the first podcasts with Drew and some other members of the firm and stuff like that. The growth has been exceptional.
Yeah, it's been very good. And I mean, you know, I think the good thing is we're at a spot with the association, and this is certainly due to our members, but also the support that you guys have offered and continue to offer and voicing it with clients. But like, we've kind of reached the snowball effect of now we get people reaching out to us weekly that are like, oh, I heard about this from Chris, or I found this online, or hey, I was on LinkedIn and I saw something shared and there's a conference in this. And now it's kind of a weekly occurrence where we get somebody that reaches out. And just last week, I mean, we had probably one of the largest employers of physicians in the country reach out and said, well, we didn't even know this existed. Yeah. And I'm like, okay, well, we got a big opportunity. So yeah, so we're kind of at that point where we keep on going, and it's really just us continue to push it forward.
Yeah. And I think what's exciting about that too is even our external viewpoint, but you talk to the clients and you talk to the systems, they're trying to get their teams involved. And that'll be a process, right? I think as we as an organization continue to grow, you know, I think that becomes a little easier, but you know, bringing cohorts of their internal, because the future of this industry is less external, it's going to be internal, and it should be, right? They know, they have their relationships, they know the physicians, they know the providers, they know the local market, and you know, you want the in-house personnel to really be confident and comfortable going into those conversations. That's half the battle.
Absolutely. Well, and that's where I think as we, you know, kind of continue, you're going to have, you know, the complexity of the work's going to continue to elevate. So you're always, you know, organizations, at least the way that I've seen it is, they're going to continue to, yes, of course, build out teams. Yeah. But it's kind of like law firms, you know, health systems didn't have in-house departments 10 years ago, and now they're huge. But the reality is they have to continue to have key partnerships with those external experts, because now the complexity of the work is elevated. So now it's, hey, I'm not having a conversation about a very basic hospitalist issue. I'm having a strategic conversation about how we implement a virtual ICU model. And let's talk about comp, but let's talk about strategy and everything else, you know? So
yeah, I think as for us or as a firm, we've always kind of thought that way, right? And we have those conversations more and more now is, we love working with you, but you don't need to be sending us all this. Like, let's give your team the internal capabilities to do this education. They're going to get the education through AAPCP, the credential, you know, tools and things that we can create to help like support organizations, like consulting guides, the digital consulting guides and things like that.
So at least as it's related to us starting and thinking about education in this space, a big missing piece is, you know, we're all self-trained. You know, everybody is. And so, yes, some of us have backgrounds in the legal field, you and me. Others have a background more from the accounting side or the BV side. But we're all kind of coming at these same things in a similar way. I mean, we're trying to solve the problem. So, you know, one thing we identified early on was there's really an opportunity for us to build the next workforce in this space by offering the education that maybe we didn't have. Now, you know, I think there's valuable components to it that would be valuable for you and me, but there is a lot of it is geared towards people that haven't had a decade of experience or more in this area though too. And those are probably most of the people in the field.
Yeah.
So if we think about the conference even, probably 75% of the group up there is at a beginner to intermediate level.
Yeah.
The experts in the room are the 10%. And not that the experts can't learn from the credential. Sure, they should get it. We would encourage that. But the reality is this is going to help that future generation move towards that expert level in a much more supportive way than kind of just, hey, let's hope they got the right training.
Yeah. And I think it's even in getting back to like the regulatory environment that we live in, right, I think it's going to be more imperative than ever. So like if you think of traditional business valuation, they have the ASA.
Yep.
And that's a credential that the courts or experts look to have.
Yep.
And you see all of the case law and settlements related to comp issues. I mean, this is going to put something out there that is meaningful for like elevating the profession.
Yep.
And that's external and internal. Like, so when you're getting reviewed, is your team know what they're doing?
Yeah.
Right? Like that's important.
It is very important.
So I think it's just going to lift and elevate individuals. And I'm also a big proponent of like, giving back, like people,
Yep.
Like we all do. People can learn from our battle scars, right? Like they should. You want to have that kind of ability in this kind of safe place like the conference to talk about the war story and develop best practices based on that.
Yeah,
so.
Absolutely. And I think, as the credential continues to move forward, I think you are going to see, whether it's courts, the government, certainly the large employers in the industry, I think they're going to be looking at it to say, okay, well, now we've got something to kind of help guide us for people that do know their way to navigate around this, And so, like I said, I think there's a lot of people that have a lot of experiential expertise, and that's extremely valuable. But as we think about this area becoming more and more important within healthcare, I mean, it's only getting more complex. It's not being simplified. So now we're talking about, hey, the way that we were trained 10 years ago or more is now in an environment for newer individuals or intermediate individuals where it's that much more complex.
Yeah.
So now we're going to have, and then I just think through continuing education with it, there's a whole platform through the credential now to sit there and say, well, wait, Chris, what are you seeing out there that we really need to be training people on?
Yeah.
And then you can say, hey, yeah, I'd be happy to teach you, talk about giving back, hey, I'd be happy to do that. And now we have a mechanism for people to get those updates.
Yep. Yeah, it's interesting. I'm thinking about that just through this conversation there's a real life example. We were laughing before we sat down today about, interrogating is the wrong word, but if you're under an investigation. So I went through an investigation on behalf of one of my clients. I have on my profile that I'm on the committee for the AAPCP. They asked about it. Like, what is that? And, you start talking about it and like, oh, okay, that makes sense. So this is really related to the field that we're talking about. I don't know, what direction it swayed them, but they're like, what is that organization? What do they do?
Well, and they'll see it more and more because I do think, you and I both know there's a lot of individuals out there that work in this space, but, the expertise isn't necessarily there always. So I think certainly when you're getting into investigations, government, scrutiny, they're going to want to figure out, like, who are we talking to here?
Who's going to set the standard?
Yeah, absolutely. So hopefully that's where it's going. I think it will.
Yeah, I think so. I think the traction's there.
So I think there's two types of way of looking at kind of value to the association through members, whether it's healthcare organization, valuation firms, consultants, some law firms. I think there's the value of what it brings to the community. We need all the players here. And it's just, you can't have a whole baseball team where everybody's just the first baseman, So here we really need the entire field. We need as much of the market as possible, because then we're going to get the perspectives like you on the panel with Jay. I mean, she is in a very large private practice medical group that is dealing with things much different than I am dealing with.
Yeah.
But that perspective is very valuable.
Yep.
And so I think part of the value of bringing everybody together is you do have that deep bench of expertise when it comes to sharing ideas. We're having lunch together. We're doing this.
Yeah.
And then I also think, you have, from a leadership perspective, I think you have individuals that are in healthcare organizations that are at a leadership level that are seeing like the internal dynamics. And then I think you've got external experts like yourself who are really seeing kind of the dynamics crossing over multiple organizations. I mean, more than that. And so when both of those come together, you now are having a conversation of, you can learn from, oh, you're dealing with this internal dynamic stuff. And then they sit there and say, wow, I didn't realize like this is going on in these places. So I think that is just a major value to the knowledge base and thought leadership. And I think beyond that, we've talked about value to members. To me, yes, we're going to have a credential, and yes, we're going to have a conference, and, all of these pieces, but all of it is about building that community. And I think if we can continue to do that, people are going to say, hey, some things are going to work. We're going to try it. I think we're trying speed networking today at the conference. We'll see if it works. And then others, are going to say, hey, this conference is something I go to every year. And that's, the value that I get out of it. So, yeah.
Yeah, I think it's the network, right? I think the lift to the community and those conversations. So one health system is one health system, one hospital is one hospital.
Yep.
They're all structured different. To your point is, at the end of the day, you strip out the noise. The comp professionals need to be the comp professionals, but they need to know how they interact and interface with legal, HR, finance. And I think this is an opportunity for those organizations that create that team to have that space. Take it to the moon, Alex.
Yeah. So, I think there's a couple of, maybe pipe dreams, but maybe we'll be there. I think one, in the short term, we're really focused on creating, the best community experience possible. I think that's the short term, and I think that's always going to be there, but like that is the focus right now. Like, let's continue to have people meet people. Let's continue to have fun conferences, all sorts of opportunities. I do think the AAPCP, though, more broadly, long-term, you think about just different changes that the government has made, for example. So, the government, CMS decides, well, we're going to do a bunch of crazy stuff with the CMS fee schedule in 2021. Well,
blow up everyone's universe.
Yeah, and I'm willing to bet there was no real experts to talk to understand the implications of that change. And you think about G2211, you think about reimbursement. Does it truly have an impact on costs related to healthcare, maybe down the line compensation? I don't know if there's a resource for the government to lean on. And I don't mean lobbying, but I mean, how can we connect the government with experts that know this space? So if they're thinking, hey, in 2028, we'd like to make some major changes with the fee schedule, I'd love for them to call us up, and I'd love to say, hey, here's Chris's number.
Yeah.
He's going to sit down with you and talk with you for an hour about here's what he thinks.
Yeah, and the implication.
And this is the implication. And I think part of that is there's so few experts in this space that I think if the AAPCP can continue to foster building that, then we could be a much larger voice in some of these major changes within healthcare in the future.
Yeah, I think in the past they've gone to the AMAs of the world, right?
Absolutely.
And maybe it's not a branch of the AMA, but a collaboration with, because they have a very important voice in that too.
Absolutely.
But they're thinking about it from the perspective of the physicians or providers, and there's economic realities to those types of changes that, aren't thought through all the time.
Absolutely.
And it makes it almost impossible for our clients to operate. It's surprising given that turmoil. Like, how many just flip the switch on the fee schedule? 5%? Most of them, managing, right?
Yep.
Appropriate compensation using the old fee schedule. People slowly transition, but like that's not intended.
Absolutely. Well, and that's where I think the association's role in some of this is, we're not advocating for anything other than doing it right.
Yeah.
Now, we get people view right all sorts of different ways, but I think there's kind of this thought of, well, you might have physicians that think, well, we're on the other side of them, or nurse practitioners, or you name any other healthcare professional. Or that, even if we were talking about policy related things that, we've got an advocacy role.
Yeah.
I kind of view it as we're operating within a regulatory structure where our job is to try to get it right for all parties.
Yeah, exactly.
And so, even when, I think we have individuals working on behalf of employers, I've never heard anybody say, listen, I don't want to advocate for our workforce. I mean, everybody sits there and says, we need to strengthen our healthcare professional workforce. And I think part of our role is, yes, there's dollars and cents to it, but 90% of it is the strategic level of how do we align our healthcare professionals with financial sustainability, but also success and, the best outcomes possible.
Yeah, you think of like Steve Covey, win-wins.
Win-wins.
That actually exists if you think about it. If you are proactive in the strategy,
Yep.
There's no reason why everyone can't win.
Absolutely.
So it's interesting. And I also think just at the again, that level of confidence for the members. So even internally, think of like the internal dynamics that I think these professionals have felt for so long is they never really had a voice. And now they're coming to the table because they're educated and they can have those conversations with physician leadership,
Yeah.
legal, and say, well, stay in your lane a little bit, right? Like, this is my specialty. This is your specialty. Let's talk and figure this out together.
Absolutely. Absolutely.
For more information, visit askphc.com. If you or your organization would like to learn more about the AAPCP, you can find more information and resources on their website, providercompensation.org.